Thank you, Clyde, and good morning. It's a pleasure to see you all here and those of you who are with us virtually. As Clyde said, I'm Bob Graham. I have served as the chair of the committee for the past year. It's been a privilege working with them. Clyde did a very good job of introducing individuals on the committee who are here. There are two additional committee members who are here, and I would at least like to recognize their presence, Drs. Joseph Wright and Neha Rakur. And there are, hopefully, the rest of the committee is watching this and see whether or not we live up to their expectations. Clyde was also very gracious in recognizing the staff that we worked with, and I think Fred and I, as chairs, would echo our appreciation for their work and support. Studies of this type usually take about 18 months, and this was done inside of about 9 months. A lot of work for the committee, an awful lot of work for the staff, and we're very appreciative of what they did and the way they brought things together. So with that, my job is to start out, give you just basic background, and then we'll go to the 5 presentations that go into the substance of the report. We'll come back. I'll comment on our 6th recommendation. Thank you. There are only 6 recommendations, so we try to keep it simple and keep it focused. And then we'll open it up for Q&A. Mike's on either side of the room. I will serve as moderator, take people roughly in the order that they come, but we'll try to make sure as we get questions from the web that we get them feathered in and everybody has a chance. First slide shows the project sponsors. Very important, the IOM has very limited funds to conduct the type of research and studies that it does. We're very dependent upon sponsors who will support the areas of interest and priority. The sponsors also have the opportunity to look at the statement of tasks, give comments, make sure that we are doing something that focuses on what they see as the most important issues, because frequently the report comes back to the sponsors and says, we've looked at it, and this is what it's important for you to do. And you'll see that coming up in our recommendations. Second slide gives you the specific statement of task. I will not read that, and I know it is visible for those of you on the web also. You can see, essentially, we had 2 things to do. One is to assess the literature, and we limited ourselves to the world literature, but in English language, and focused on children from the age of 5 to young adults to the age of 21. This was a conscious decision on the part of the committee to set boundaries. Children at the age of 5, roughly when they start schooling, 21, roughly at the time that they finish college. There can be legitimate issues in terms of brain development and the impact of sports outside of those boundaries, but that was our focus. And then our responsibility, having done all of that research, conversations within the committee, what are the significant findings? We make recommendations. Committee's approach, pretty much just have covered. A question that we always have as we start this discussion is, well, what is your definition of concussion? So I think the next slide will give you that definition. Concussion is a brain injury along a spectrum of mild to moderate to severe brain injury. Concussion is in the mild section. Next slide. Whoops. Okay, that's, I'm sorry, Morgan, I thought the definition was going to be on the slide, but I think it must not be. If you would go back, I will read the definition that those of you who are familiar with this field, it is derived from the 4th International Conference on Concussion held in Zurich in 2012, and states in part, concussion is a brain injury and is defined as a complex pathophysiologic process affecting the brain, including induced by biomechanical processes. So that is the definition which provided the floor for our activity. So now we can go to epidemiology, and I think Tracy, the panel will speak from their places.